Good morning everyone. It's me Sanju Pandit. Welcome back to channel Medical with Sanju. Nepal Nursing Council Model Exam set-19c. Question number 150. The mother of a 2-month old infant brings the child to the clinic for a well baby check. She is concerned because she feels only one testis in the scrotal sac. Which of the following statement about the undescended testis is the most accurate? Option A. Normally the testes are descended by birth. Option B. The infant will likely require surgical intervention. Option C. The infant probably has with only testes. And option D. Normally the testes descended by 1 year of age. म्याक्सिमम बच्चाहरूमा स्क्रोटलमा टेस्टिस बाई बर्थ नै डिसेन्ट हुन्छ, तर 1 वर्षमा पनि यो हुन सक्छ. सो इट इज अ नर्मल. नर्मली द टेस्टिस डिसेन्डेड बाई द 1 year of age. Option D is right answer. Question number 151. In assessing the patient condition using the integrated management of childhood illness approach strategies, the first things that a nurse should do is to: Option A. Ask what are the child's problem. Option B. Check the patient level of consciousness. Option C. Check for the 4 main symptoms. And option D. Check for the general danger sign. The right answer is option D. Check for the general danger sign. First ma chai हेर्नु पर्छ. Question number 152. Meena, the mother of an 11-month-old girl, is in the clinic for her daughter's immunizations. She expressed concern to the nurse that Simon cannot yet walk. The nurse correctly replied that according to the Denver development screen, the media age for walking is: Option A 12 month, Option B 15 month, Option C 10 month, and Option D 14 month. Normally बच्चा 15 मन्थमा चाहिँ वाकिङ गर्छ. Option B is right answer according to Denver development screen. Question number 153. The 12-year-old boy has fractured his arm because of a fall from his bike. After the injury has been casted, the nurse knows it is most important to perform all of the following statement on the area distal to the injury except: Option A capillary refill, Option B radial and the ulcer pulse, Option C finger movement, and Option D skin integrity. The right answer is Option A capillary refill. Capillary refill, pulse and skin temperature and the color are indicative of intact circulation's absence of a compartment syndrome. Skin integrity is less important. Question number 154. The nurse finds a 5-year-old boy having a grand mal seizure. What action should the nurse take first? Option A. Place a pillow under his head. Option B. Place a bladder tongue blade between his teeth. Option C. Straddle his leg and holds his arm. And Option D. Call for help. Option A is right answer. The nurse needs to protect the client from injury using the paddle side rails, airway at a bedside pillow under head, loose clothing and clear space. Question number 155. A 8-year-old child who has a past history of acute rheumatic fever is admitted for treatment of a streptococcal infection. The nurse would monitor the client for which assessment finding? Option A. Increasing joint pain. Option B. Auscultations of a systolic murmur. Option C. Increasing urinary output. And Option D. Presence of subcutaneous nodules. The right answer is Option D. Presence of subcutaneous nodules. Tachycardia and cardiac murmur indicate cardiac involvement, which could be life-threatening with a recurrent rheumatic fever. The nurse would expect increasing joint pain with the recurrence of rheumatic fever, but this would not be the primary observation to be made. Question number 156. The membrane of women in labor ruptures spontaneously as observation by the nurse at this time that would necessitates additional newborn resuscitation measures would be option A greenish amniotic fluid, option B bloody show, option C clear fluid with aspects of mucus, option D frequent contraction. Question number 157. The nursing care plan for a client who is being admitted to the hospital with a diagnosis of abruptive placenta should include careful assessment for the signs and symptoms of option A hypovolemic shock, option B hypotension, option C jaundice, and option D impending convulsions. Hypovolemic shock हुन सक्छ. Option A is right answer. Abruptive placenta means immature separation of placenta. In abruptive placenta, there is a uterine bleeding that can result in a massive internal hemorrhage causing hypovolemic shock. Question number 158. A primiparous client who delivered a viable term neonate vaginally 48 hours ago has a midline episiotomy and repair of a third-degree laceration. When preparing the client for discharge, which of the following assessment would be most important? Option A constipation, option B rectal fistula, option C diarrhea, and option D excessive bleeding. Mostly constipation मा चाहिँ टिचिङ दिनुपर्छ discharge को बेलामा. The client with a third-degree laceration should be assigned for constipation because a third-degree laceration extends to a portion of the anal sphincter. Question 159. A pregnant client at 8 weeks gestation is admitted to the hospital with vaginal stainings but no pain. On vaginal examination, cervical OS is closed. Which is the most likely tentative diagnosis? Option A missed abortion, option B inevitable abortion, option C threatened abortion, and option D incomplete abortion. The right answer is option C, यो threatened abortion हो जुनमा OS चाहिँ क्लोज भएको हुन्छ. मिनिमम मात्रामा यसमा ब्लिडिङ भएको हुन्छ जुन मा के हुन्छ त प्रेग्नेन्सी कभर गर्न सकिन्छ. Question 160. When evaluating a client's knowledge of symptoms to report during her pregnancy, which assessment would indicate to the nurse in charge that the client understands the information given to her? Option A, I will report increased frequency of urination. Option B, if I have blood or double vision, I should call the clinic immediately. Option C, if I feel tired after resting, I should report it immediately. And option D, nausea should be reported immediately. First priority, blood or double vision छ भने immediate चाहिँ contact गर्नुपर्छ because of it is the sign and symptoms of a eclampsia. Question number 161. After completing a second vaginal examination of a client in labor, the nurse midwife determines that the fetus is in right occipital anterior positions and at a positive station. Based on these findings, the nurse midwife knows that the fetal presenting part is option A 1 cm below the ischial spine, option B directly in line with the ischial spine, option C 1 cm above the ischial spine, option D in no relationship to the ischial spine. Ischial spine बाट स्टेशन डिटरमाइन गरिन्छ. एट ischial spine मा छ भने स्टेशन 0 हुन्छ. ischial spine भन्दा एबभ छ भने माइनस मा र बिलो छ भने प्लस मा हुन्छ. यहाँ प्लस दिएको छ सो आन्सर अप्सन ए हुन्छ 1 cm below the ischial spine. Question number 162. A client makes a routine visit to the prenatal clinic. Although she is 14 weeks pregnant, the size of her uterus approximates that in an 18 to 12 weeks pregnancy. Doctor diagnoses gestational trophoblastic disease and ordered ultrasonography. The nurse expects ultrasonography to relieve option A, an empty gestational sac, option B, grape-like clusters, option C, severely malformed fetus, and option D, an extrauterine pregnancy. The right answer is option B, grape-like cluster size-ma हुन्छ. In a client with gestational trophoblastic disease, an ultrasonography performed after third month show gap-like clusters of the transparent vesicles rather than of fetus. Question 163. During a prenatal visit at a 4-month gestation, a pregnant client asks whether tests can be done to identify fetal abnormalities between 18 and 40 weeks gestations. Which procedure is used to detect fetal anomalies? Option A, amniocentesis. Option B, chorionic villi sampling. Option C, fetoscopy. And option D, ultrasound. Ultrasound is used between 18 and 40 weeks of gestation. It identifies normal fetal growth and detects fetal anomalies and other problems. Amniocentesis is done during the third trimester to determine fetal lungs maturity. Chorionic villi sampling is performed at 8 to 12 weeks gestation and it detects genetic disease. Fetoscopy is done at approximately 18 weeks gestation to observe the fetus directly and obtain a skin or blood sample. Question 164. A client with eclampsia begins to experience a seizure. Which of the following would the nurse in charge do first? Option A, pats the side rails. Option B, place a pillow under the left buttock. Option C, insert a paddle tongue blade into the mouth. Option D, maintain a patent airway. The priority for a pregnant client having a seizure is to maintain a patent airway. Option D is right answer, the first priority. Question 164. A client arrives at a prenatal clinic for the first prenatal assessment. The client tells a nurse that the first day of her last menstruation period was September 19, 2005. Using Snagles, the nurse determines the estimated date of confinement as Option A, June 12, 2007. Option B, June 26, 2006. Option C, June 12, 2007. And option D, June 26, 2006. दिएको एलएमपीमा 9 month and 7 days एड गर्नुपर्छ निगल्स रुलमा. यसको क्लास ईडीडी को क्लास एन्ड जेस्टेशनल एज कसरी निकालिन्छ भन्ने क्लास भइसकेको छ. डिस्क्रिप्सन बक्समा यसको लिंक चाहिँ शेयर गरिएको छ, यहाँले चाहिँ ओपन गरेर हेर्न सक्नुहुन्छ. 2005 मा 7 days and 9 month एड गर्दा June 26, 2006 आउँछ. अप्सन बी इज राइट आन्सर. Question 166. A nurse is caring for a pregnant client with a severe preeclampsia who is receiving IV magnesium sulfate. If magnesium sulfate toxicity occurred, which medicine has to be administered as antidote? Option A, calcium gluconate. Option B, protamine sulfate. Option C, naloxone. And option D, acetylcysteine. The antidote of magnesium sulfate is calcium gluconate. Question 167. Which of the following hormones functions to promote milk production in mammals? Option A, prolactin. Option B, vasopressin. Option C, thyroid hormone. And option D, oxytocin. Prolactin. Option A is right answer. It is also known as leukotropic hormone or leukotropion. Is a protein that is best known for its role in enabling mammals, usually females, to produce milk. Question number 168. Which of the following circumstance is most likely to cause uterine atony and lead to PPH? Option A, hypertension. Option B, cervical and vaginal tears. Option C, uterine retention. And option D, endometritis. Uterine retention causes a distended bladder and displaces the uterus above the umbilicus and to the side, which prevent the uterus from contracting. The uterus needs to remain contracted if bleeding is to stay within normal limits. Option C is right answer. Uterine retention. Question number 169. Methargine or pitocin is prescribed for women to treat PPH. Before administration of these medications, the priority nursing assessment is to check the option A amount of lochia, option B blood pressure, option C deep tendon reflexes, and option D uterine tone. Methargine and pitocin दिनुभन्दा अगाडि blood pressure assess गर्नुपर्छ. Option B is right answer. These two are agents that are used to prevent or control PPH by contracting the uterus. Question number 170. A nurse is assessing a client in the fourth stage of labor and notes that the fundus is formed but that bleeding is excessive. The initial nursing actions would be which of the following? Option A massage the fundus. Option B place the mothers in the Tendelberg's position. Option C notify the physician, and option D assess for cervical laceration. If the bleeding is excessive, the cause may be lacerations of the cervix अथवा birth canal. Option D is right answer. Question number 171. A nurse is preparing to perform a fundal assessment on a postpartum client. The initial nursing actions in performing this assessment is which of the following? Option A. Ask the client to turn on her side. Option B. Ask the client to lie flat on her back with the knee and legs flat and straight. Option C. Ask the mother to urinate and empty the bladder. Option D. Massage the fundus gently before determining the level of the fundus. Ask the mother to urinate and empty the bladder. Option C is right answer before starting the fundal assessment. Question 172. Medicines mifepristone and misoprostol is mainly used for. Option A surgical abortion. Option B bleeding disorder. Option C medical abortion. Option D medical abortion premenstrual syndrome. यो मेडिसिन ब्लिडिङ डिसअर्डरमा युज गर्छ. अप्सन बी इज राइट आन्सर. क्वेसन नम्बर 173. Which of the following is a common complication of breech delivery? Option A cord prolapse, option B preterm labor, option C PPH, and option D shoulder dystocia. Cord prolapse is the common complication of breech delivery. Question number 174. What is the normal amount of amniotic fluid? Option A 800 to 1200 ml, option B 500 to 800 ml, option C 1200 to 1500 ml, and option D more than 2000 ml. The normal amount of amniotic fluid is 800 to 1200 ml. Option A is right answer. Question number 175. Which of the following is not a change associated with the menopause? Option A dyspareunia, option B reduced libido, option C breast get smaller, option D vaginal pH falls, and option D vaginal become drier. Breast get smaller. Option C is right answer. Question number 176. What is the recommended daily preconceptual dose of folic acid? Option A 4 mg, option B 0.4 mg, option C 4g, and option D 0.4 g. Option B 0.4 mg. Question number 177. Normal level is the process by which concentrations of the gravid uterine expels the fetus and other products of conception. Option A between 37 and 42 weeks from the last menstruation period. Option B before 37 weeks gestation. Option D after 42 weeks of gestation, and option D after 24 weeks of gestation. Between 37 and 42 weeks of the gestation from the last menstruation period. Option A is right answer. Question number 178. After the first 4 months of pregnancy, the chief source of estrogen and progesterone is the option A placenta, option B adrenal cortex, option C corpus luteum, and option D anterior hypophysis. Placenta is the chief source of estrogen and progesterone after 4 months of pregnancy. Question number 179. During a prenatal examination, the nurse drew blood from a young Rh negative client and explains diet and indirect COMS test will be performed to predict whether the fetus is at risk for option A. Acute hemolytic disease, option B. Respiratory distress syndrome, option C. Protein metabolic deficiency, option D. Hyperbilirubinemia. Acute hemolytic disease is the right answer. If mother को negative र baby को positive छ भने. Question number 180. A pregnant woman at 32 weeks of gestation complains of a feeding disease and lightheaded while her fundal height is being measured. Her skin is pale and moist. The nurse's initial response would be to assess her woman's blood pressures and pulse. Option B. Have the woman's breathe into a paper bag. Option C. Raise the woman's leg. And option D. Turn the woman on her left side. Left side ma turn गर्नुपर्छ. Option D is right answer. During a fundal height measurement, the woman is placed in a supine position. This woman is experiencing supine hypotension as a result of uterine compressions of the vena cava and abdominal aorta. Question 181. During fetal life, the blood vessels having maximally oxygenated blood is option A. Aorta, option B. Inferior vena cava, option C. Pulmonary artery, and option D. Umbilical vein. Option D. Umbilical vein मा maximum चाहिँ oxygenated blood हुन्छ. After the exchange of oxygens and nutrients, the umbilical vein carry fresh oxygenated and nutrient-rich circulating back to the fetal systemic circulation. Question 182. A nurse is caring for a pregnant client with preeclampsia. The nurse prepares a plan of care for the client and documents in the plan that if the client progresses from the preeclampsia to eclampsia, the nurse's first action is to option A. Administer magnesium sulfate intravenously, option B. Assess the blood pressures and fetal heart rate, option C. Clean and maintain an open airway, and option D. Administer oxygen by face mask. The right answer is option C. Clean and maintain an open airway. Question 183. The nurse is measuring the durations of the client's contraction. Which assessment is true regarding the measurement of the durations of contraction? Option A. Duration is measured by timing from the beginning of one contraction to the beginning of the next contraction. Option B. Duration is measured by timing from the end of one contraction to the beginning of the next contraction. Option C. Duration is measured by timing from the beginning of one contraction to the end of same contraction. Option D. Duration is measured by timing from the peak of one contraction to the end of same contraction. Option A is right answer. Question 184. During which of the following phase of the menstruation cycle is it ideal for implantations of a fertilized egg to occur? Option A. Secretory phase, option B. Ischemic phase, option C. Proliferative phase, and option D. Menstrual phase. Secretory phase. Option A is right answer. Question 185. The hormone responsible for the development of the ovum during the menstruation cycle is option A. Progesterone, option B. luteinizing hormone, option C. estrogen, and option D. follicle stimulating hormone. Follicle stimulating hormone. Option D is right answer. Question 186. Heartburn and flatulence in the second trimester are the most likely the result of which of the following? Option A. Decreased gastric acidity, option B. Increased plasma acid levels, option C. Increased intestinal motility, and option D. Elevated estrogen level. During the second trimester, the reductions in gastric acidity in conjunction with pressure from the growing uterus and a smooth muscle relaxation can cause heartburn and flatulence. Option A is right answer. Question 187. Which of the following represents the average amount of weight gain during pregnancy? Option A 12 to 20, option B 15 to 25, option C 25 to 40, and option D 25 to 35 lbs. 15 to 25 lbs. Option B is right answer. Question 188. For patients at a high risk for the food ulceration, self-management education involves option A. Inspecting feet daily, daily shocking of a feet, and knowing who and when to call for help. Option B. Inspecting feet daily, cleaning walking path at home, and knowing who and when to call for help. Option C. Knowing who and when to call for help, good glucose control, and only walking barefoot indoors. Option D. Inspecting feet daily, wearing any kind of shoes, and keeping good glucose control. Inspecting feet daily, cleaning walking path at home, and knowing who and when to call for help. Option B is right answer. Question 189. A client is admitted to the labor and delivery unit. The nurse performs a vaginal exam and determines that the client's cervix is 5 cm dilated with 55% effacement. Based on the nurse's assessment, the client is in which phase of labor? Option A active, option B latent, option C transition, and option D early. Option A active. 0 to 4 cm सम्म cervix dilation भएको छ भने त्यसलाई latent phase भनिन्छ. 4 to 7 सम्मलाई active phase and 8 to 10 cm लाई transitional phase भनिन्छ. Question 190. When assessing a laboring client, the nurse finds a prolapsed cord. The nurse should option A attempt to replace the cord, option B place the client on her left side, option C elevate the client's hip, and option D cover the cord with a dry sterile gauze. The client with a prolapsed cord should be treated by evaluating his hip and covering the cord with a moist sterile saline gauze. Option C is right answer. Question 191. Partograph monitoring should be started when? Option A. Cervix is fully dilated. Option B. When cervix OS is closed. Option C. When cervical dilation is 4 cm. And option D. When cervical dilation is 2 cm. When cervical dilation is 4 cm. Start गर्नुपर्छ partograph. Question 192. Sexual intercourse should be avoided in pregnancy when there is. Option A. Vaginal bleeding or leakage of fluid. Option B. Preterm rupture of membrane. Option C. Sexually transmitted disease. And option D. All of the above. यो सबै केसमा चाहिँ एभोइड गर्नुपर्छ sexual intercourse. Option D is right answer. Question 193. Abortion when vaginal bleeding and uterine cramping result in expulsions of a part of the products of conception is called. Option A. Threatened abortion. Option B. Incomplete abortion. Option C. Complete abortion. And option D. Missed abortion. यो incomplete abortion option B is right answer. Question 194. As a young manager, see no diet conflict occurred in any organization. Which of the following statement regarding conflict is not true? Option A. Can be destructive if the level is too high. Option B. Is not beneficial, hence it should be prevented at all times. Option C. May result in poor performance. And option D. Make great leaders. Is not beneficial, hence it should be prevented at all times. Option B is right answer. Question 195. Which of the following is evidence that the controlling process is effective? Option A. The things that where plants are done. Option B. Physicians do not complain. Option C. Employees are contented. Option D. There is an increase in customer satisfaction rate. Option A is right answer. Question 196. The following are basic steps in the controlling process of the department. Which of the following is not included? Option A measures actual performance. Option B set nursing standards and criteria. Option C compare results of performance to standards and objectives. Option D identify possible courses of action. Identify possible courses of action. This is a steps in a quality control process and not a basic step in the control process. Question number 197. As a younger manager, यो क्वेशन आइसकेको छ योभन्दा पहिला. Question number 198. Notes plans of assessing competent people to fill the roles designed in the hierarchy. Which process refers to this? Option A staffing, option B scheduling, option C recruitment, and option D induction. Option A is right answer, staffing. Staffing is a management function involving putting the best people to accomplish tasks and activities to attain the goal of the organization. Question 199. In the case of disaster, as a nurse manager, which leadership style is best to pursue? Option A democratic, option B benevolent, option C laissez-faire, and option D autocratic. यो भनेको इमर्जेन्सी कन्डिसन भएर इमर्जेन्सी कन्डिसनमा अटोक्रेटिक लिडरशिप स्टाइल चाहिँ युज गरिन्छ. अप्सन डी इज राइट आन्सर. क्वेसन नम्बर 200. Some managers have a benevolent, authoritative styles of management. Which of the following behaviors will C exhibit most likely? Option A have condescending trust and confidence in their subordinated. Option B give economic or ego awards. Option C communicate downward to the staff, and option D allow decision making among subordinates. The right answer is option A. Best of luck to all. Thank you so much.